Breast cancer is the most frequent cancer among women. 1 woman in 8 risks suffering from breast cancer at some point in her life. Now, thanks to medical progress and systematic screening campaigns, 90% of breast cancers can be healed if they are screened early enough. Various treatments are explained in this film as we follow an early breast cancer patient step by step from diagnosis to cure. A multidisciplinary approach is needed when treating breast cancer. Most patients with early breast cancer are initially directed to the sonology unit, which specializes in breast infections.
Hello. I believe this is our first meeting.
Yes, it is.
So, what's happened?
A few months ago, while I was taking a shower, I discovered a small lump in my right breast.
After going over the patient's medical records and learning more about her medical, surgical and family history, the sonologist examines her breasts and lymph nodes.
Again?
The doctor prescribes a series of medical imaging examinations to attain a more thorough diagnosis. A radiologist supervises the mammography. This normally painless examination consists of 2 X-rays for each breast. According to what is found in the X-rays and through clinical palpation, the radiologist may perform an echography. This imaging technique uses ultrasound for a more precise diagnosis. If the presence of a suspicious nodule is confirmed, a biopsy will be performed to obtain a small piece of tissue. This biopsy is done with a needle and is essential for finalizing the diagnosis.
Do you have the results from the tests we've done? What do they indicate?
Well, I received all your results, including the mammography, the ultrasonography and the biopsy. And unfortunately, it's, well, what we thought.
Okay.
There is a small lesion, very small. It is in an early stage, but you've had it for some time. The biopsy has revealed a tumor in your breast,
Okay.
known as an invasive ductal carcinoma.
2 post-examination results are possible. Either the patient has a cancer in situ, meaning without risk of metastasis of the lymph nodes or elsewhere in the body, or invasive cancer. If such is the case, the sonologist will ask for an extended assessment, meaning additional tests to affirm that there is no metastasis.
These white areas are the mammary gland.
Yes.
If we compare the right side to the left, you see there is a small irregular spot.
That's the lump I found.
There. That's the little lump.
Depending on the diagnosis, post-surgical treatment may be followed by radiation therapy, hormone therapy, and possibly chemotherapy. This film demonstrates the most frequent type of case, which includes surgery, radiation, and hormone therapy, but without chemotherapy.
Here are the nipple and areola, and these are the ducts and labules. And you have a small lesion that has moved into one of these ducts. This is known as a ductal carcinoma. We have to remove the lesion, but also see if your lymph nodes
They're under the right arm.
are infected or not. We will then use X-rays or radiation therapy to save your breast.
Why radiation therapy?
It's a supplementary post-surgical treatment. In your case, as it's an early tumour, we should be able to save your breast. We have to supplement your treatment with radiation therapy, that's to say with X-rays. You'll have X-ray sessions
Every day?
following the operation every day over a 4 to 6 week period. Radiation therapy will begin 1 month after surgery.
The doctor takes this opportunity to ask the patient if she is willing to participate in a clinical study to help improve future treatments. It is important for the development of research and to increase full-term recovery rates. Decisions concerning therapy are taken during multidisciplinary meetings with the radiologist, sonologist, oncologist, radiation oncologist, oncogeneticist, pathologist, plastic surgeon, physiotherapist, and nurses specialized in sonology and breast cancer consultation. Depending on the particular case, a social worker may be included. A treatment plan is also decided upon in pluridisciplinary consultation based on the patient's file as prepared by the sonologist, covering all aspects of the case, including the extended assessment results. The patient is notified that the operation will be performed in the 2 or 3 weeks following the multidisciplinary meeting. However, she is first invited to a pre-hospitalization consultation as well as consultation with the anaesthetist. The patient then meets with her nurse consultant to review each aspect of the diagnosis to ensure that everything has been well understood.
I'd like to go over all the information you've received up until now to see if you have any questions.
No, it's just afterwards, I'm feeling a bit anxious.
The patient's support systems are also discussed during this consultation.
Do you live alone or with someone?
I'm married, but my husband isn't often around. He works and all that.
Okay. Now, there are numerous support groups, including Geneva Patient Associations and the Geneva Cancer League. We also have information brochures with their contact details.
Hello, I'm Emily. Hello. I'm one of the nurses from the service. I'm going to perform a lymphoscintigraphy. Has anyone explained to you what this is?
It's an injection.
Yes, a slightly radioactive injection is administered to the breast at the tumour level.
And does it hurt?
You might experience a burning sensation during injection, but only then. You'll feel nothing afterwards. It's quite painless. You will then return to the nuclear medicine unit 2 hours later for imaging the sentinel lymph node.
The lymph node to which the malignancy first spreads is called the sentinel node. With the help of medical imaging, the surgeon can identify the exact location of the node and excise it from the nodal station.
We're looking for the tumor. You hear noise when we're over the tumor. Now we move away. And again, that's the first sentinel lymph node.
The surgeon removes the sentinel lymph node and immediately sends it to the pathology lab for rapid analysis to see if it has been infected or not. In most cases, the surgeon takes a very conservative approach, removing the tumor only without removing the patient's breast. It is called a lumpectomy. When the excision is larger, the operation is known as a quadrantectomy. In some cases, a mastectomy or total ablation of the breast must be performed. If such is the case, reconstructive surgery is also proposed. Such surgery can be done immediately during the operation if there is no contraindication. If the results of the sentinel lymph node diagnosis are positive, the surgeon will perform a lymph node dissection, which means a total ablation of the nodal station. The patient is hospitalized in the gynecology unit from 3 to 7 days. She must stay longer if a lymph node dissection has been performed. In such case, further physiotherapy is required.
You can go all the way up to your head without pulling on the scar tissue or the drains. You can comb your hair, you can put on your makeup, you can do everything as usual. Drive, eat, wash yourself. Just be careful of the scars and bandages when you shower. But for the rest, you can do as you've always done.
The nurse consultant and the patient meet again after the operation to see how things are going, particularly because patients often experience temporary depression in the days following surgery. Post-operative treatment is decided upon during another interdisciplinary meeting wherein diverse aspects, particularly the final diagnostic results, are analysed.
Her case began last month. She discovered a painless nodule near the upper outer quadrant. She had never had a breast screening before. Her doctor...
A new operation may be decided upon if, for example, the excision was incomplete. In some cases, which we do not address in this film, an initial phase of chemotherapy may be decided upon before radiation therapy. If there is to be no chemotherapy, radiation therapy will begin 1 month after the operation. In the meantime, the patient meets with a radiation oncologist who presents and explains what radiation therapy is.
Radiation therapy is used to prevent the disease from returning locally. It is estimated that there is a 20% risk of return. However, in the long term, radiation therapy, which I will explain to you in a moment, reduces that risk to 4 or 5%.
Radiation treatment can improve one's chances of complete recovery by preventing metastasis between organs and other parts of the body, whereas hormonal treatment reduces the risk of cancer in the other breast and avoids metastasis.
Are there any secondary effects? How does it work?
There will be a local reaction, a skin irritation like sunburn, towards the end of the 3rd week. You will have to apply prescription creams to reduce or curb it. Contrary to chemotherapy, there will be no loss of hair, nor will you suffer from canker sores, diarrhea, or vomiting. The body deals well with this type of treatment. Aside from the fact that you will have to come here every day, it's not really very difficult.
Before the patient begins actual radiation treatment, she will undergo a simulation procedure that takes approximately 1 hour. The goal is to ensure maximum comfort for the patient and ease of administration for the therapists. The area to be treated is pre-located and marked with 3 small dots around the breast. The scan images of the breast and in the position that the treatment will be applied enable the practitioner to visualize the breast and the organs to be protected, the heart and the lungs.
Okay, just relax. We're starting.
These images will be transferred to a programming system used to prepare the treatment. The patient need not be present as everything is prepared virtually.
Okay, so let's pull up the pictures over
The
here.
system helps define the irradiation parameters for treating the breast, the primary tumor, and any possible additional local lymph nodes while protecting all tumor-free organs.
That's the planning. For me, it's good.
About 1 centimeter of the lung has been lightly treated, but that's fine.
Radiation therapy is usually performed on workdays over a 4 to 6 week period. They last approximately 10 minutes with only 2 20-second exposures to X-rays. There are normally no side effects, although a burning sensation is occasionally felt. The sonologist will conduct an oncological checkup each quarter of the first year.
Perfect. No, I'm really pleased. It looks good. I'll just verify that there's absolutely nothing there.
Then every 6 months over a 3-year period, and once a year thereafter if everything goes well.
How are you? How did it go?
I'm fine. It was a bit tiring, though. It's tiring, but it's okay. It's good. I'm glad it's over.
Most professionally active patients return to work once radiation therapy is finished. Other than a probable 5-year hormone therapy, therapeutic follow-up is relatively light in cases of early breast cancer.
Life goes back to normal.
Exactly.
You have to deal with the situation, the problems.
There is life after treatment. Either the nurse consultant or the various support groups are there to help you at all times. Do not hesitate to ask any and all questions you may have and for the support you may well need.